We are back. Sorry for the absence. We recently moved to Bend, Oregon, so we are here. We are established. So everything is dandy. Today is part 4 of the Snowboarder knee series. Today we are talking about PFPS, or Patellofemoral Pain Syndrome, and patellar fractures. So tune in. Before we get started, my name is Mark. I am a doctor of physical therapy with my wife, Sarah. We are a mobility duo. We are health professionals who work primarily with snowboard athletes and other ski athletes, providing you with rehab, prehab, strength, conditioning, flexibility, you name it. Please hit that like button. It helps us out a lot with the YouTube algorithm, and we really appreciate it. We work hard on these videos, so thank you. So if you didn't see part 3, part 2, or part 1, check those out. Previously we talked about meniscal injuries and ACL tears. Some of the most common injuries with snowboarding. So, patellofemoral pain syndrome, what exactly does that mean? The biggest distinction between patellofemoral pain syndrome and patellar tendonitis is patellofemoral pain syndrome, or PFPS, tends to stay or get worse with activities, specifically squats, lunges, stairs, anything that requires the knee to bend that's going to place pressure on that kneecap. What separates this from patellar tendinopathy is tendinopathies tend to get better after use, and then will generally get worse again after you stop exercising. One of the other big distinctions with PFPS is pain is generalized kind of all over the knee, so on the front side of the knee, whereas patellar tendinopathy or tendonitis will generally be at the lower part of that tendon or the kneecap. So what are some of the reasons why people would develop this, especially on the mountain? Usually it's because of overuse or overload. And what we mean by that is if you are kind of working or snowboarding more than usual, it'll place more stress on that kneecap. Or let's say you are doing a little bit more than you normally would. We would call that overload. Again, placing more stress than your body is used to. Some of the other things that we as physical therapists tend to look at, anatomical abnormalities. So what that means is we would look at the way your kneecap structure is going over the femur, the way it's sliding over. Muscular weaknesses, specifically in the quads, on the muscles in the front, the hips, things like that. And then we would also tend to look at ankles. So the ankle can actually play a big part in PFPS, as far as if your foot is kind of falling inwards like that, it'll force your leg to do other things that we like to say internal rotation of the tibia. So the long bone below your knee is moving inwards towards your other leg. The other thing to note with PFPS is this tends to be a chronic issue, and what chronic means is it's longer than your 1 to 2 to 3 weeks. This tends to be a nagging discomfort for people over a period of 6, 8, 12 weeks, to the point where they finally seek medical attention. So what are some exercises or things that you would do as a snowboarder or athlete to approach this? Something that I would look at especially is hip weakness, so specifically hip abductor weakness, so your ability to raise your leg outwards. If your hips are weak, it's going to draw your knees in, which will then pull that kneecap or patellar outwards. I would also look at that quadricep strength, so that muscle in the front, so your ability to fully extend that leg. That tends to be weak. Other things I would tend to look at are if you are having that pronation or that ankle falling inwards, you might look at insoles, so something that'll create an arch in that foot. You may look at tight hamstrings. If there is a tight hamstring, it could be placing too much pressure on that kneecap. So if you kind of try to loosen that up, it'll give that kneecap some room to breathe, so to speak. So great exercise for this because it has a tendency to affect those who go in that squat position. I might start with a small step down. So you could do maybe like even a textbook. I've used a textbook with patients in clinic. So you might start with that. You could do an eccentric or a slow lowering to the count of 3 to 5. You could use a quad extension machine. So I love the 3 seconds up, 3 seconds down. So how long does it take for something like this to heal? We like to look at the 6 to 12 week mark. That gives room for muscle growth or hypertrophy. Everyone's different. So those who are, athletes who have the ability to grow muscle more quickly are going to heal a little bit faster, but then it also takes that consistency, 3 to 5 times per week with your exercises. Okay, so patellar fracture. So like I mentioned in, I think, video 2, part 2, very famous Marcus Kleveland sustained one of these after hitting a direct blow to his kneecap, essentially fractured his patella in many different pieces. It's super rare. It's less than 1% of injuries, but it does happen, especially with those who are into jibbing, who are going off of large jumps. That direct blow to the kneecap is super common, or excessive flexion or bending of that knee will place too much pressure and force on that kneecap. There are quite a few types of these patellar fractures or kneecap fractures. I guess the 2 major ones are, one is going to either affect the cartilage or not, so the stuff underneath the bone, and the other one potentially affect the blood supply to that patellar, that kneecap. So you have some fractures that keep that patellar together, where you have some like Marcus Kleveland where it splits it in multiple pieces. So what are some things that we try to observe if we suspect that there is a patellar fracture? So the most obvious one is going to be swelling, tenderness. If it is separated, you're going to see separation in that bone. The athlete it's going to be difficult for them to extend or flex that leg. When we are looking for or confirming that, obviously we would get an x-ray, or if it's too small to tell, we would do a CT scan or a bone scan. So what are some things that we can do if you were to undergo one of these? If you are looking for conservative treatment, generally these are for the injuries that aren't affecting blood supply or the cartilage underneath, and they're usually not separated. So this would be the conservative approach. Your doctor would essentially place you in kind of an extensor mechanism locked extension. So your leg would be forced this way for 4 to 6 weeks. You'd be on crutches for 6 to 8 weeks. And then flexion, or your ability to bend, would be introduced slowly as that kneecap was healing. Some of the things that you would start with are isometric movements like straight leg raises, quad squeezes, glute squeezes. You can work on hamstrings a little bit. If you choose or don't choose to get surgery, generally what will happen is many times they pin the bones back together. So it does require kind of a similar situation where your leg is locked in that extension in a brace. So or a cast. You'll be in that cast for up to 6 weeks. Again, you'll be walking on crutches again. The recovery is ultimately based on the surgeon. Now, there are quite a few plans on what surgeons believe and how they were trained. So generally, that's the number one rule of thumb, is how aggressive or non-aggressive the surgeon is. When you were to start treatment, it's very similar. So you would introduce flexion slowly. Start with isometrics, or holding that squeeze in the muscle for a period of time, 3, 5, 10 seconds. You could, again, strengthen your glutes, quads, partial weight bearing based on the surgeon's request. And then based on your sport, let's say this is back to snowboarding, you would slowly increase the complexity of the movements. So you might start with isometrics initially, and then you can do open closed chain movements. You can do jumping, plyometrics, power movements, eventually to get you back to that sport ready shape. Okay, that's it. This is part 4. I apologize for the delay. We went through the moving process and traveled a little bit, but we are back onto a consistent schedule. Otherwise, let me know what you think. Anyone who's been through one of these or thinks you may have are experiencing, especially PFPS, let us know in the comment box below. Otherwise, we will be back next week. Thanks.